Have you ever noticed that your body just doesn't respond the way it used to in your younger years? Maybe reaching climax takes longer, or it feels different than it did before. You're not alone, and the truth is, our sexual response naturally changes as we age. But here's the good news. Changes in sexual pleasure aren't a sign that your life is over. They're simply part of the natural rhythm of aging. In fact, understanding these changes can open the door to more satisfying, fulfilling experiences than ever before. Today, we're going to explore exactly how orgasms evolve over time, what's normal, what you can do to adapt, and how you can maintain intimacy and pleasure well into your 40s, 50s, 60s, and beyond. Hi, I'm Dr. Thomas Spears, MD, a sexual health specialist, and I've spent years helping adults navigate changes in their bodies and relationships. In this video, we're diving into a topic that's often misunderstood or even considered taboo: how orgasms change as we age. We'll break down the science in a simple, approachable way, discuss common myths, and give practical advice you can actually use. Whether you're single, in a long-term relationship, or just curious about your own body, this video is for you. Make sure to hit the subscribe button and turn on notifications so you never miss our weekly tips for healthy, enjoyable sexuality at every stage of life. Now, let's get started. How aging affects sexual response. As we age, several physical and hormonal changes can impact sexual response. For women, menopause typically brings lower estrogen levels, which can affect blood flow, vaginal lubrication, and sensitivity. For men, testosterone gradually declines, which can influence arousal and orgasm intensity. But it's not just hormones. Aging can slow nerve response and reduce circulation, which may make orgasms feel different or take longer to achieve. It's important to remember that these changes are completely normal. Everyone experiences them differently, and they don't mean your sex life has to decline. Understanding the body's natural rhythm allows you to adjust your approach, explore new techniques, and even improve your overall sexual satisfaction. What changes you might notice? Some common changes adults notice as they age include longer time to reach orgasm. Both men and women may find that it takes more stimulation or patience to reach climax. Less intense orgasms. Orgasms may feel less explosive, but this doesn't mean they're less pleasurable. Changes in refractory period. For men, the time between orgasms often increases. Variations in sensitivity. Some areas may become more or less sensitive, which can be an opportunity to explore different forms of touch and intimacy. These changes are natural and do not indicate a loss of sexual ability. In fact, many people report more satisfying orgasms later in life because they know their bodies better, communicate more openly with partners, and feel less pressure about performance. Practical tips for enhancing pleasure as you age. Here are some practical, medically sound tips for maintaining satisfying sexual experiences. Prioritize foreplay and arousal. Spending more time on arousal can help compensate for slower responses. Stay physically active. Regular exercise improves circulation, flexibility, and stamina, all of which support sexual function. Communicate openly with your partner. Discuss what feels good, what's changed, and what you'd like to try. Consider lubrication or sexual aids. For women experiencing vaginal dryness or men needing help with arousal, these can make intimacy more comfortable. Manage health conditions. Diabetes, high blood pressure, and certain medications can affect sexual response. Talk to your doctor about options. Tips. Quick, actionable advice. Explore new types of touch or stimulation that may feel better with age. Focus on intimacy and connection, not just orgasm. Practice mindfulness or relaxation techniques to reduce anxiety around performance. Schedule time for sex like any other self-care activity. It helps maintain consistency and enjoyment. Myths versus facts. Myth number 1. Orgasms just stop after a certain age. Fact. While orgasm frequency or intensity may change, adults can continue to have satisfying orgasms well into their 70s and beyond. Myth number 2. Changes in orgasm mean something is wrong with your body. Fact. These changes are normal, natural, and vary from person to person. They don't indicate illness, though persistent sexual problems should always be discussed with a healthcare provider. Understanding how orgasms change as we age helps us approach intimacy with knowledge, confidence, and compassion for ourselves and our partners. Remember, slower or less intense orgasms are a normal part of life, not a loss of ability. With patience, communication, and some practical strategies, sexual satisfaction can remain strong and even improve with age. If you found this video helpful, please give it a like, leave a comment sharing your experiences or questions, and subscribe for more science-backed advice on sexual health after 40. I'd love to hear from you. What's one thing you've noticed about how your sexual response has changed over the years? Let's continue the conversation. Together, we can normalize healthy sexual aging and make pleasure a priority at any age.